Healthy adipocytes play a crucial role in maintaining metabolic harmony by producing anti-inflammatory cytokines that actively suppress excessive inflammation, support tissue repair, and preserve insulin sensitivity. Far from being passive bystanders, fat cells secrete key mediators such as adiponectin and interleukin-10, IL-10, which act locally within adipose depots and systemically throughout the body to balance immune responses and protect metabolic health. Adiponectin, one of the most abundant adipokines secreted by fat cells, has powerful anti-inflammatory effects. It reduces the expression of pro-inflammatory cytokines like TNF-A and IL-6 in both adipose tissue and vascular endothelium, while enhancing the production of anti-inflammatory signals. Adiponectin also promotes the polarization of macrophages toward the M2 anti-inflammatory phenotype within adipose tissue, supporting a healing environment that preserves insulin sensitivity. In the liver and skeletal muscle, adiponectin dampens inflammatory pathways that interfere with insulin signaling, helping to maintain effective glucose uptake and metabolic flexibility. IL-10, another critical anti-inflammatory cytokine produced by adipocytes and regulatory immune cells within fat, is a master regulator of inflammation resolution. It directly suppresses the activity of pro-inflammatory macrophages and T cells, reducing the secretion of damaging cytokines that drive chronic low-grade inflammation, a hallmark of metabolic diseases like obesity-related insulin resistance and type 2 diabetes. Elevated IL-10 in adipose tissue has been shown in animal studies and human observational data to correlate with improved insulin sensitivity and reduced systemic inflammation. The ability of adipocytes to produce these anti-inflammatory factors is especially important in the dynamic environment of adipose tissue, where constant expansion and contraction during energy surplus or deficit create mechanical and metabolic stress. Anti-inflammatory adipokines like adiponectin and IL-10 help resolve microinjuries in fat depots and prevent excessive immune activation that could otherwise escalate into chronic inflammation and fibrosis. Furthermore, this balancing act between pro- and anti-inflammatory signals in adipose tissue determines whether it remains metabolically healthy or becomes a driver of disease. In lean, insulin-sensitive individuals, anti-inflammatory cytokines predominate, keeping immune cells in a regulatory state that supports tissue remodeling and metabolic homeostasis. By contrast, in dysfunctional adipose tissue, such as that seen in visceral obesity, production of adiponectin and IL-10 declines, while pro-inflammatory cytokines surge, tipping the balance toward a chronic inflammatory state that disrupts insulin action and damages metabolic tissues. Interventions that restore or enhance the production of anti-inflammatory cytokines in adipose tissue, like exercise, calorie restriction, or pharmacological agents targeting inflammatory pathways, have been shown to improve insulin sensitivity and reduce the risk of type 2 diabetes and cardiovascular disease. These findings highlight the central importance of adipocytes as sources of anti-inflammatory mediators that not only maintain adipose tissue health, but also confer systemic protection against metabolic and inflammatory diseases. Altogether, the secretion of adiponectin, IL-10, and other anti-inflammatory signals by fat cells demonstrates that healthy adipose tissue is a dynamic regulator of immune balance and tissue repair. By producing these protective cytokines, adipocytes actively resolve inflammation, support metabolic homeostasis, and maintain insulin sensitivity, underscoring their indispensable role as guardians of systemic health rather than harmful entities.